Physical therapy versus surgery. Now, over the 15, 16 years that I've been providing physical therapy care, I've sometimes had to argue with patients and try to talk them out of surgery because they are so adamant that they need surgery. I have to have my knee replaced. I have to have my hip replaced. And after I do my evaluation and I diagnose them with a muscle strain or some other soft tissue inflammation that's causing their pain that has nothing to do with the arthritis that's at their knee or their hip, they still want to argue and say, but I need to have it. My doctor said the x-ray showed this and the MRI showed that. And I'm flabbergasted. I don't understand why someone would advocate for themselves to go under the knife and have a joint replaced when they don't need to have it. And I've had many of my patients say, hey, you know what? I'm arguing with you about this, but let's see what you got. And after a few sessions, they say, oh my God, I can't believe I was going to have my knee replaced. The knee feels great now. And I tell them, hey, you still have arthritis. You want to go have that knee replaced? And they say, hell no, I'm not going to have the knee replaced. Why would I? I have no pain. By the way, that's the number one reason why someone will have a joint replacement, because of pain. And it should be because of if they truly have osteoarthritis, which is where the cartilage is completely gone, and you need to have diagnostic tests like the x-ray or the MRI match up with clinical findings. So when your physical therapist does all the tests and says, yeah, you need to have your joint replaced, that's when those two things match up, and that's when you should probably go get your knee replaced. And even then, I would say, go get a second or third opinion before you go and do it. Okay? Physical therapy, as I always state, is the most effective and least invasive form of treatment. If you have some dire, life-threatening diagnosis that you need to go take care of right now, you know, your spinal cord is at great risk of being cut off or damaged to the point where you may not be able to walk, or something else like that where it's emergency surgery, then yes, by all means, don't say, well, let me try physical therapy first. No, do it. Go have the surgery. But if you have anything else like, hey, you know what, your knee's got a lot of arthritis or your hip's got a lot of arthritis, and that surgeon tells you, so let's schedule that surgery, think to yourself, why should I jump to the most invasive treatment? I know they gave me a pretty good reason why I should do it. Your x-rays show this, you have a lot of pain, why don't we just go replace it? But try physical therapy first. I'm not saying you got to go for 6 months. You come in and see us or any good physical therapist, they should be able to tell you in the first day whether you really need to have surgery. But within 2, 3, 4 weeks of rehab, twice a week, which is what, 8 sessions, you'll know, yeah, I need to have surgery. Or, more often than not, what I've had here is patients feel much better and they never have the surgery at all. So again, I always say, when the doctor's telling you to count back from 10 and they're putting you under anesthesia to have that replacement, don't you want to feel like I did everything I could before I got to this operating room? That's the way you should do it. Don't be like the many patients I've had that just never try anything else and they just go right for the surgery. And a lot of times people regret it. So really think about it. If it's not an emergency, try physical therapy first.